Welcome everyone. Thank you for joining us in tonight's section. It's really amazing to have you all here, and we are happy to have you. Thank you for joining. Keep joining, keep sharing the link so others can benefit from this section. So my name is Timmy. I'm the practice manager from Dr. Seyi Absolute Wellness. And in the section with me, we have Dr. Seyi Adebayo, who will be leading us through the webinar. So today we'll be addressing diagnosing and managing acid reflux. All you need to know about acid reflux should. So welcome you all once again. And permit me to share my slide. I don't know if you can all see my slide. So I'll be giving a brief introduction about Dr. Sheyi, who will be taking us through today's webinar. So Dr. Seyi Adebayo and I'm Doctor of Medicine from the Wisdom University School of Medicine. She's an active member of the South African Society of Integrative Medicine and the Institute for Functional Medicine USA. Dr. Seyi strong believes that by providing the body with the tools and environment it needs, you allow and encourage the body to heal itself. She believes everyone should be treated as an individual because we are all different and should be treated as such. So most of us may be confused as regards the meaning of functional medicine. Functional medicine means root cause medicine, that is diving deep into your medical concern, running labs, and doing an in-depth research on your health status, thereby arriving at the root cause of your concern, and we're able to provide a permanent solution. So that is what makes our practice very different from the regular medicine. We welcome you once again, and we would want Dr. Sheyi to take over the section. Do enjoy the section. So let's dive in. Dr. Sheyi, over to you, ma'am. Dr. Sheyi, we can't hear you.
Okay, please can you mute yourself? There's this sound coming from your side. Please mute yourself. Yeah. Okay, yes. Um, okay. Hello everyone. It's good to be here again. So, and thank you, Timmy. So today we'll be discussing acid reflux. As we all know, acid reflux is a big monster. In fact, that is the name I call it because acid reflux has caused a lot of problems, a lot of, in fact, people go to the hospitals and they tell their doctors, this is my problem, but the doctor just feels that, okay, could it be the heart? You have an issue with the heart. Could it be this? Could it be this? And no, they are not able to pinpoint what exactly the problem is. So now we'll be picking it one after the other. So let's dive into the into it. Okay, so um, hello, Sim, please can you see my slide?
Yes,
Hello.
I can. Yes, I can.
Okay, please, we would like to see your face too.
Yes, I
Okay,
can.
good. We can see my slide, right? Okay, good. So now, okay, so what is and this these are the things we're going to learn. Look at the things that we're going to learn. These are the things we're going to learn. Let's go straight into the points. What exactly this problem is? Acid reflux is when or GERD is when the contents of your stomach persistently, just note those words, persistently moves back into the esophagus. The esophagus is the pipe here, the one that carries your food in. After you eat your food, it takes your food inside. So that is when it persistently goes into, it persistently moves up into the esophagus. So this content sometimes contains excessive acid and may cause irritation and pain. And this is why you keep having this pain. You keep having that irritation along the throat. You feel that something is stuck there. Something is there that you can't just explain what exactly it is. This is as a result of that backwash, as a result of that backflow of that acid into the esophagus. Normally, acid should not get into your esophagus. Where the acid should stop is the stomach. The acid is produced in the stomach, and it should stop also in that stomach. That is where it should stop. It should not go into the esophagus. It should not go into the throat. So now, what's the difference between acid reflux and GERD? Acid reflux occurs when stomach acid flows back into the esophagus. Then GERD is a chronic and more severe form of acid reflux. So it occurs when acid reflux happens frequently, leading to complications and damage to the esophagus. Now, can you notice these two differences? Acid reflux is just simple. When the acid goes back into the esophagus, that is it. And the GERD is a more chronic problem whereby this acid reflux keeps happening, like, acid keeps going back into the esophagus repeatedly, and it causes damage. I'm sure there are lots of times that people on this webinar, you'd have noticed that, oh, you just get that back flu. Maybe it happens once in 6 months, once in 1 year. Why some people consistently feel this thing every day? Like every day, they are so unhappy because they must have that acid backflow. And there are times that for some people, the acid now flows back and you're not even aware again that the acid is flowing back. You cannot taste it. You cannot feel it. But you just start noticing that you have pain again around that region. You understand? So that could be the reason why. So that is the reason. That is the exact difference between these two things, the acid reflux and the GERD. So now, many people may experience acid reflux, indigestion, heartburn from time to time. However, if you experience acid reflux symptom more than twice per week, you may have gastroesophageal reflux disease. Now, this takes me back to what I explained earlier, that some of you may just have this reflux issue, maybe just once in 6 months, once as in once in 1 year. But now, notice this. It says that if you keep having this thing at least twice per week, then meaning you have moved from the level of acid reflux to GERD. Do you understand? Meaning if you have this more than two, you have acid reflux, heartburn more than twice a week, you have moved. So what are the common symptoms that are associated with this thing? The most common symptoms are persistent heartburn, which involve a burning feeling in the stomach that may rise to your chest, neck, and the throat. Like you feel this burning sensation in your chest, to your neck, to your throat. You have this sour or bitter taste at the back of your mouth. You have regurgitation of food or liquid from your stomach from your stomach into your mouth. I know a lot of you experience this and you're wondering that, oh my God, what exactly will I do? How will I resolve this problem? Because it's really a big problem for so many people. Because of this, you're not able to work very well. You're not productive again. Because a lot of my clients will tell me that, doctor, since I started experiencing this terrible thing, I've not been able to drive again. I've not been able to walk again. I've not been able to do things that I used to do. Some people may even have this feeling of lump at the back of their throat. I know a lot of you are listening to me right now and you have that feeling at the back of your throat. You have chronic cough, this cough that refuses to go despite several antibiotics. You use the antibiotics, it will not go. You have sore throat, use the antibiotics, it will not go. You use all form of menthols that you have, but this cough will still not go. So there are times that this cough could be as a result of acid reflux. So this hoarse voice, bad breath. Yes, a lot of people with acid reflux also experience bad breath. So that is why there are times that when you have bad breath that we call halitosis in medicine, it could be as a result of bad gut health, like poor gut health. Acid reflux is one of them. So in some cases, people may express alarming symptoms associated with GERD. These are typically persistent. Alarming symptoms may also indicate an underlying condition. Alarming symptoms may include difficulty swallowing, that we call dysphagia in medicine. Like you find it difficult to swallow. A client once told me that, Doctor, I cannot even swallow well. It has gotten to that stage. You have pain when swallowing. We have nausea, vomiting. Some people, there's nothing irritating them. You just have this feeling that you want to vomit. Weight loss, you're just losing weight unnecessarily. You ask yourself, okay, why am I losing weight? You cannot even pinpoint it. So a lot of people are losing weight because of acid reflux. Anemia, because you are bleeding somewhere inside. The acid is erosive in nature. So when it's erosive in nature, it can cause inflammation and you begin to bleed somewhere internally. And that could cause anemia because that is blood, you're losing blood. You understand? Then, okay, bleeding, just like it's written down there. So I hope you're all following me. So now let's get on to root causes of acid reflux. It's very important that whenever you have a medical condition, and that is where my practice is, my practice focuses on root cause medicine, like Timmy has highlighted earlier. If you are treating any medical condition, be it hypertension, diabetes, weight loss, you don't understand the root cause. Now, let me give you an example of weight loss. You are obese, you're overweight, and you want to lose weight. You've tried all remedies, you've tried everything, and this weight and this, you drop this weight, you drop this weight for some times, you drop this weight for like maybe you drop this weight, but in the next 3 months again, you're already having this weight back. I begin to ask yourself, is it that these things I'm using are not working? But have you asked yourself, what other problems does your body have that could be stopping you from losing this weight effectively? Number one, it could be your hormones. Number two, it could be inflammations. Number three, it could be the choice of food you're eating. So many things that we can. So these are what we call the root causes. So what are the root causes of acid reflux? Number one is weakened lower esophageal sphincter. So now there's a connection between your stomach and your esophagus. So that connection, I'm sorry, we're still going to see a diagram here. So that connection, take for example, this is your okay, let me just take okay, now let me just use this. Take for example, this is your stomach here, this is your stomach here, and this is your esophagus here. You see these points here where they are joined together. These points where they are joined together is called the sphincter. That's an opening, it's called a sphincter. So this sphincter can get weak. And when this sphincter is weak, meaning just we're talking about acid that is produced in the stomach. So when this sphincter is weak, meaning the acid can easily move up from the stomach into the esophagus, to your throat. And that's why when it moves to your esophagus, because your esophagus is right close to your chest, you begin to have heartburn. When it goes to your throat, you begin to have the sore throat, the inconvenience in your throat. So when this lower esophageal sphincter is weak, you could have acid reflux. So what are the things that could, ask me, okay, Dr. Seyi, now you talked about the lower esophageal sphincter. Okay, what are the things that can make it weak so that I can start assessing myself? So now right here on this webinar, I want you to start assessing yourself. When I'm saying these things, start asking, okay, could it be because I'm aging? Aging could be a factor. And this is why it's important that as you're aging, you need to get the right collagen to start taking. You want to ensure that your body is, you're building your body, giving your body the right nutrients, the right vitamins, so that all your cells, your tissues are all functioning properly, and they have proper elasticity. Obesity. If you're on this webinar today and you're on the big side, like you're fat, you're big, please, you need to lose weight. Because even if you're doing everything and you're on the big side, you may not really get solution to your acid reflux. If you smoke, please, you want to stop. If you are pregnant, yes, it's a normal, we women want to be pregnant. It's a joyful, it's something that is wonderful for us, a wonderful experience. So if you are pregnant and you have acid reflux, you may have to bear it, or speak to your doctor or your gynecologist, your obstetrician, on what to do to curb it. You can do some little ginger here and there, but if you are pregnant, there is nothing you can do about it. It happens sometimes. And there are certain medications also that can actually make your lower esophageal sphincter very weak. So hyperhernia occurs when the portion of the stomach pushes upward through the diaphragm, which can disrupt the barrier between the stomach and the esophagus. Hyperhernias can develop due to congenital factors or as a result of pressure on the abdominal area, such as during pregnancy and due to obesity. So now look at the picture of hyperhernia. That on the other side now, yes, here's a picture of the esophagus and the stomach. You can see the connection between the stomach and the esophagus. That is the sphincter I was talking about earlier. Now you can see the hyperhernia as in above the diaphragm, like a balloon. So obesity and overweight, I talked about this, carrying extra weight on your body puts as in causes more pressure on your stomach. So this can lead to stomach acid traveling to your esophagus, causing heartburn, belching, chest pain, and other uncomfortable symptoms. So if you're overweight and you're obese, please do something about it. Now look at this man right here. If I look at the abdominal guts, look at the waist, look at the way it's dome-like up there. There is no how it will not have issues with acid reflux. Do you understand? Look at the woman trying to button, she's trying to package herself. See, a lot of us, we do this many times. So now, dietary factors. Certain foods and beverages can relax the lower esophageal sphincter and irritate the stomach lining, contributing to acid reflux. So here are common dietary okay, here are common triggers, including spicy food. If you do a lot of spicy food, sorry, give me some minutes. Okay. So if you do a lot of spicy food, you do a lot of fatty food, fried food, citrus food, type of citrus food are oranges, lime, lemon, tomatoes, caffeine, alcohol, chocolates. You may want to reduce them if you're on this webinar. If you've been having acid reflux at least twice in a week and you do any of this food, you may want to stop them. And you may be wondering, she just talked about tomatoes. Tomatoes that I want to make stew. How am I going to do it? How am I going to do it? Do you understand? She talked about tomatoes. How will I do it? So now the thing you can do for yourself is that, yes, tomato is because of the acidic nature, it can actually cause these things to happen. So what you can do is that you can actually make your pepper soup. By just doing tatase, the rodo with a lot of onion. And you may want to take tomatoes out. I remember one of our clients was telling us one time, and he said that, oh, I feel that anytime I eat jollof rice, I always have this flare. And he said, he could not pinpoint the reason why he was having that flare whenever he eats jollof rice. So we had to attribute it to, could it be as a result of the tomato in the food? Do you understand? So we figured out it was as a result of the tomatoes in the food. So by the time he now did another jollof rice, he did not have tomatoes to eat. And trust me, things really changed for him and got better for him. So now let's go on to the next one. So we have pregnancy. Hormonal changes and increased abdominal pressure during pregnancy can lead to acid reflux. So what are the causes? These changes are a natural part of pregnancy, and acid reflux. Now, I already talked about this. Pregnancy is a natural, is a natural thing. There's nothing you can do about it, because the stomach, just like that man that you saw, that his abdomen was big. Look at this man, so it goes up. So that's why he's having that. So smoking can relax the lower esophageal sphincter and reduce saliva production, which normally helps neutralize the stomach acid. So if you're on this webinar and you smoke, please, you want to do something about it. Smoking is a personal choice, and quitting smoking can reduce the risk of acid reflux and improve overall health. We also have medications. Medications can weaken the lower esophageal sphincter and increase stomach acid production, contributing to acid reflux. So here, example of medications: the non-steroidal anti-inflammatory medications, such as the likes of the ibuprofen that you take for pain, some muscle relaxants. So just think, when you talk about muscle relaxants, if you take a muscle relaxant, that might relax the muscles around the esophageal sphincter and make it loose for acid to go up. Stress and anxiety. Stress and anxiety is something that can also make your acid reflux worse. If you notice on days that you're stressed, you'll see that these symptoms become very, very worse. So if you have battling with a lot of emotional issues, you may want to sit down and work on yourself deliberately. Eating patterns. Eating large meals, lying down immediately after eating, or eating close to bedtime can increase the risk of acid reflux. So we have medical conditions. Look at these medical conditions that can also cause acid reflux. Now, identifying and addressing the root causes of acid reflux is crucial for effective management. So now we've been able to identify the root causes, and I know that you also have been able to identify some of the root causes of the acid reflux you've been experiencing for years. So what are the consequences? Consequences mean, what are the problems I may experience if I don't do anything about this? Esophagitis. This is continuous exposure. When the esophagus is exposed to acid every time, and inflammation and irritation occurs, which should lead to esophagitis. And this can lead to chest pain, difficulty swallowing, and bleeding. Strictures are like narrowing of the esophagus, because over time, that part has been exposed to chronic inflammation. So over time, it may start closing up. And don't forget, that's the part that your food goes through. So you may start experiencing strictures along that area. So Barrett's esophagus. In some cases, long-term untreated acid reflux can lead to a condition called Barrett's esophagus. In Barrett's esophagus, the normal cell lining the esophagus are replaced by abnormal cells that can increase the risk of developing esophageal cancer. So now, what is the definition of cancer? We all know what cancer is all about. Cancer is when we move from normal cells to abnormal cells. So now, for people battling with acid reflux, long-term untreated acid reflux, because your esophagus is getting exposed to acid all the time. We all know acid is corrosive in nature. Even acid touching your body is a big problem. So you getting exposed to acid over time, meaning the cell lining of that esophagus can start changing, and over time, if it keeps changing, it becomes a big problem, and it can lead to what's it called, cancer. From the normal cells to the abnormal cells, it can lead. So you have a risk if you've experienced acid reflux for a long time. You have an increased risk of developing esophageal cancer later in life. So that's why it's important to do something about it. Respiratory problem. Acid reflux can cause stomach acid and digestive enzymes to reach airways and lungs, leading to respiratory issues such as chronic cough, asthma, and recurrent pneumonia. Dental problem. The acid from your stomach can actually damage your tooth enamel, leading to dental erosion and other oral health issues. Chronic cough. A persistent cough, often referred to as reflux-related cough or extraesophageal reflux, can be consequences of untreated acid reflux. So this chronic cough can disrupt daily life and may not respond to typical cough treatments. Then sleep disturbance. Because when you keep having pain, you are not comfortable. How would you sleep very well? It's going to reduce your quality of sleep, you understand. Worsening symptoms. Over time, untreated acid reflux can result in more frequent and severe symptoms, making it increasingly challenging to manage and leading to reduced quality of life. Esophageal ulcers. Untreated acid reflux can cause open sores. Remember I talked about acid, acid causing erosion, acid causing problems over time will lead to wounds, and these wounds will be painful, and that they can start bleeding. Chest pain. The chest pain that you would think that you're about to have cardiac arrest. That's the type of the chest pain you experience with acid reflux. Reduced quality of life. If you are not sleeping very well, the food you used to like, that you used to enjoy, you cannot enjoy it very well. Your friends that used to love to go and visit, you cannot go and visit them anymore because you have this discomforting pain. At that point, quality of life is being reduced. So for the diagnosis, I would not want to delve deeper into these ones because these are more of the medical side, that we, on the medical terms. I know a lot of you must have gone through endoscopy. You've seen what an endoscope looks like. This is what an endoscope looks like. It checks the inner part from your esophagus to your stomach to see if you have wounds, you have irritations there and everything. So what are the things that we can do to get ourselves better? Lifestyle modification. Lifestyle modification includes number one, you want to avoid your trigger foods, like those spicy, acidic food, fatty food, chocolate, tomatoes that we talked about. As an individual listening to me tonight, you want to check what exactly the problem is coming from. What food did I eat that I started having this? So you want to check that line of food very well and take that food out. Then your eating habits. You want to ensure that you start eating in smaller portions. It goes a long way. Smaller portions of food. If you are to eat one big eba like this, you want to take that eba small, 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 small. Then you want to avoid lying down immediately after food. Weight management. Achieving and maintaining a healthy weight can reduce the pressure on your weight. I talked about this earlier. If you're on the big side, you want to lose weight, it's important. Apart from acid reflux, it's even healthy for you. Elevating the head of your bed. Raising the head of your bed by 6 to 8 inches can help prevent nighttime reflux. Like you can put extra pillows on your head. This is what this means. Smoking. Hey, if you are here and you smoke, you drink too much alcohol, you may want to quit. You want to stop. I know it's not easy. It's like an addiction. But see, when you look at this, like that cancer that I talked about now, I'm sure that it might be playing in your head. Look at the strictures I talked about, the bleeding internally, inability to eat what you want. When you think about these things, you may want to talk to yourself and give yourself some advice again on that. I'm sorry. So medications. If lifestyle changes alone are insufficient, so there are medications that our doctors give to us, antacids, H2 blockers. I know a lot of you are familiar with this, the likes of the omeprazoles, the pepcid, the ranitidine, the Nexium, lansoprazole, the prokinetics, a lot of you are, you understand. So some people even go to the extent of surgery. I may be wondering, surgery for acid reflux? Yes, we call it in medicine fundoplication rather, fundoplication. So what it does is that is it, it involves wrapping the top of the stomach around the lower esophagus to reinforce the lower esophageal sphincter we talked about earlier. That lower esophageal sphincter is the problem now. So they just wrap the top of the stomach around that sphincter, and that prevents, acid reflux. But, you don't want to go to the level of surgery to get acid reflux fixed, because these are things you can fix by yourself if you know what to do. So we also have alternative therapies. A lot of people explore alternative therapies such as acupuncture, herbal remedies, dietary supplements. So it's important to consult with a healthcare provider before trying these approaches to ensure they are safe and effective. Treatment of acid reflux is highly individualized, and the approach taken depends on the severity of symptoms, the presence of complications, and the patient's response to various treatments. So now, note what I said, because you may be saying that, okay, yeah, if you want to treat acid reflux, it has to be individualized. You have to take into see the symptoms I express for acid reflux may not be the same thing as you. Yours may be severe than mine. You're already having complications, so it cannot be the same treatment. You understand? So regular follow-up with your healthcare provider is also very, very important. So what are the preventive strategies? It's very important that we understand this. Now, you know why I love to emphasize on prevention, because I know that once you understand prevention, you can actually go out there, educate younger ones on these things, educate your children on why they should eat right, on why they should eat, all these things we've talked about. So let's talk about that right now. Dietary modifications, you already know this. You want to keep away your triggers. You want to eat smaller portions, more frequent meals. You want to chew your food thoroughly. Chewing your food thoroughly, will help you aid digestion and reduce the risk of swallowing excessive air, which can contribute to your reflux. I hope you are noting that. Maintain a healthy weight. If you're too big, please try to reduce your weight. Avoid late night eating. Eating too close to bedtime can increase the likelihood of nighttime reflux. So aim to finish your last meal at least 2 to 3 hours before lying down. Elevate the head of your bed. Elevate the head of your bed. Put pillows there. Don't lie down after eating. Avoid lying down immediately after eating. Instead, take a leisure walk or remain upright for a couple of hours. In fact, let us talk about this. Sleeping immediately after eating is not okay. In fact, to help regulate, if you're on this webinar today, you're battling with diabetes, or someone with battling with diabetes, give them this one advice. Tell them that immediately after eating any food, let them just take a walk. Let them go around and do exercise. It's really going to help the way the body processes the sugar that the food is giving them. Wear loose fitting clothes, especially if you have big stomach and you have acid reflux and you're not wearing tight clothes. It's going to aggravate, especially for we women that we use waist trainers and you have acid reflux. It's going to cause more problems for you. Limit your alcohol consumption, your caffeine, avoid smoking. We've talked about this. Stress management, engage in stress relieving activities such as deep breathing, meditation, yoga, and regular exercise. Medications, these are medications that you can jump on if lifestyle and dietary changes are not working for you. Regular checks up with your doctor. Sleep. Make sure you sleep very well. Avoid eating and drinking and taking medications before bedtime. And raise awareness. Like I said earlier, raising awareness is very important. And you want to educate yourself about acid reflux, because like I said earlier about root cause medicine, once you understand your root cause, you're able to manage yourself. And this will also help you to go out there and teach a lot of people about these things. So it's important to know that the preventive strategies can vary from person to person. What works for one individual may not be as effective for another. Therefore, it's essential to work closely with a healthcare provider to develop a personalized preventive plan based on your specific needs and symptoms. So, and this will be all from my side today. And thank you for listening. And I hope with all this I've said, you're able to pick important points and things you can start doing for yourself going forward. Please take note of all these things we've talked about. And I'm handing over to Miss Timmy right now.
All right, thank you so much, Dr. Seyi, for the
All
section. It
right.
was really, really amazing. And we are glad to inform you that many of our clients are really happy about this section. Thank you so much. So,
Oh, thank
a brief recap as regards of what Dr. Sheyi took us through. She defined the acid reflux, differences between acid reflux and GERD. She also told us the consequences of untreated acid reflux, and that is why we are here. Definitely, you have a gut problem, then it is very important that you fix it as soon as you can, because looking at the other side, when you don't treat this concern as soon as you notice them, could result to number one, you spending a whole lot of money, number two, the discomfort, the pain, everything that has to do with God's concern is. So definitely we don't want a situation that we get to that level. So that is why we are here to help you. So permit me to share my slide as well, as we'll be taking you through the solution we have for you all. As so many people have been dropping messages as regards the solution. So yeah, we are bringing the solution to you. Permit me to share my slide. Okay, yes, we are there. Um, okay, so at Dr. Sheyi Absolute Wellness, we have three effective remedy when it comes to eradicating acid reflux. So I want everyone on this group to note that when it comes to healing, yes, it comes with a lot of determination. It comes with a lot of, when I say determination, yes, you must be determined that you want to get over this concern. And that is why you have to be intentional as regards your treatment plan. So at Dr. Shea Absolute Wellness, we have three amazing options for your gut health. So number one is the gut healing kit. Number two is the comprehensive gut healing package. And number two is a course on acid reflux. So permit me to continue with my slide. So we have the gut healing kit. The gut healing kit consists of the intestinal repair, hallucination, we have the cleanse, we have the colon cleanser. So it is a combination of different products. They are all herbal products and formulated by Dr. Shehi, who understands herbal formulation, and she is also a medical doctor. So imagine a medical doctor, a certified medical doctor, venturing into the formulation of herbal products. So you're sure to get a very, very good result. So the gut healing kit is very effective on heartburn, chest pain, bloating and gas, belching, sensation of a lump in the throat, chronic cough, H. pylori, gastritis, anything that has to do with your gut health, any issue you're having from the mouth to the anus means there's something going on with your gut. So anything going on in that part, then be sure that the gut healing kit takes care of it. So I know many people will come with the question that, okay, does this permanently treat this concern? Yes, the gut healing kit is formulated to heal the gut properly. It heals it heals the gut and takes out all abnormalities in the gut. Do you understand? So if you're having gastritis, H. pylori, all the symptoms I've listed previously, then the gut healing kit is for you. So, like Dr. Sheyi stated before, that when it comes to healing the gut, especially for cases that are very severe, if you're having hyperthermia, if you're having chronic gastritis, if you have serious inflammation going in your gut, especially when you run your labs and it's a whole lot, you're going through pain, you can't eat well, you have issues with food tolerance, you just feel pain, you feel discomforted, and a whole lot of things, then definitely this package is for you. This comprehensive gut healing package is a one-on-one section with Dr. Sheyi. It's a 12 weeks program that involves Dr. Sheyi sitting with you, checking through your medical concerns. You would run some labs. So it's a 12 weeks program. So I would like to read what I stated here. The gut is the foundation of everything, as it aids digestion of the food you eat, absorb nutrients, and uses it to fuel and maintain your body. However, if you have an unhealthy gut, your body will struggle to get rid of those toxins. And when it occurs, it can cause so many issues. So imagine if your gut is not in good shape, meaning you can't you can't be yourself. Yes, that's the plain truth. You can't be yourself. So when you have these concerns, it's very important that you take charge over your health. So this comprehensive one-on-one section covers the private consultation with Dr. Seyi, comprehensive stool analysis. So this stool analysis is a functional lab. We don't run them in Nigeria. We send your samples to the US for testing, yes, because it does a whole lot. It gives us a great analysis, gives us the actual analysis of your concern, especially when you're battling with gut related concerns. So it also involves it's also we are going to also run the organic acid testing, which analyzes a whole lot of nutrients in your body. So most of the time, most of the problems we face as individuals could be as little as nutritional deficiency. So these labs is we'll be able to know that okay, this is what we need to work on. These are things that we need to focus on. So it also covers personalized plan tailored to your assessment, detox and cleans, sleep optimization. A lot of us on this table, we can't sleep like we want to do. So imagine not being able to sleep. It's as in it's just like a part of you is gone. Yes. So sleep is very important to your well-being. So not being able to sleep due to this concern is something you need to take a step. You need to take the move because you can't keep going on that way. So we also involved gut microbiome optimization, stress management, weight management, support for medication throughout the program. So it is an amazing section. It is a program that you need to opt in for if you have any of these concerns. If you have chronic gut concerns that you really need someone to sit with you, talk to you. It covers your medication, it covers that, it covers everything. Just invest your money and you're sure to get your health back. So we have the Nidura probiotic. Yeah, this is actually not, you like it's not one of the treatments though. It is just a support medication because we've noticed that a lot of clients, maybe because of these gut concerns, most of the time, probably we didn't explain, the gut actually houses a higher percentage of our immune cells. And when the gut is invaded, it actually has an impact on your immune system. Yes, it weakens the immune system. So it weakens the immune cells. So um, this Ludora it helps in weight loss management, reduces pain and inflammation, improves sleep, help digestion, reduce belly fat, restores gut flora, increases energy, decreases bloating, reduces digestive issues, faster recovery from spot injury, snoring, immune deficiency. Yeah, the main function is immune deficiency. So it helps um, to improve your immune cells so that you don't get sick every other time. So if you fall sick regularly because of your immune cell or your immune system is weak as a result of this gut concerns, then the Nodura is a support medication with your gut healing kit. So for being a part of this webinar, we'll be giving discounts on all our products or services. Yes, I forgot to state, I didn't list it on my slide. We also have a comprehensive course, yes. And reason why you shouldn't miss out of this comprehensive course is that it's a different thing to use the medication, it's a different thing to also know your food triggers, it's a different thing to also know what and what to do. So because it's put together by Dr. Seyi, who is an expert when it comes to your gut optimization. So if you need guidance, definitely everyone needs guidance as regards food triggers, what to avoid, food as medicine. A lot of recipes is included in this course. It's a comprehensive course. So if you're buying your kit, would advise that you also get the course so that you don't keep having the occurrence. Yes, the gut healing kit works, but definitely you not being able to abstain from things that will make your symptom get worse may not allow you get desired results. So it is very important. Definitely, we are trying our best to ensure that we sensitize you, but the course is comprehensive and well detailed enough for you to read through and you're able to get results with your gut healing kit. So for being a part of this webinar, you have discounts on all our products, our services from today till 4 days time. So the gardening kit is 45,000. Once you check through our platform, once you check through our website www.drshay.com, But being a member of this webinar, being a participant, will be given to you at 40,000 naira for 4 days. So it's amazing. You're taking out 5% off from this. For the course, okay, so for the Nudura probiotic, it is 48,000 naira, but being a member of this will be giving you at for 3,000. Then the course on the gut health, yes, it is 50,000 naira on seller. Once you check our platform on seller, it is 50,000 naira to access the course. But being a member of this webinar, you have it at 35,000 naira. So meaning, as you're getting your kit, you should also think, or you should also consider adding this course to your plan. So we have the advanced gut health package. The original price is 2.8 million naira. Yes, 2.8 million naira. And this is not charge. This is it covers consultation, covers your medications, covers advanced labs we don't run in Nigeria. And the reason why we go that far is that many of us, we've done endoscopy, we've done a lot of ECG, we've definitely we've not gotten to the root cause of the concern. But these functional labs gives us an idea, gives us a full picture of what exactly you're going through, and with that we are able to get results. So that is why we go all the way out to ensure that we know the root cause and we are able to fix it. We are able to fix all nutritional deficiency, if any. So this is an amazing package. You just pay your money, then we work on you, and you're getting yourself back. So definitely it is something you should jump on. It is not service charge, I repeat. The package is put together to ensure that you get it. You understand? A lot of our clients we work on as regards this package, they go all the way out, travel out of the shores of Nigeria, and still don't get results. They still come back to this package. So meaning, if you're considering that, the first option is to consider Dr. Seyi Heal My Gut package. Yes, this is one you shouldn't miss out from. So thank you so much for being a part of this webinar. We have 4 days to enjoy amazing discounts from being a participant. So this is the end of my section. Dr. Shiri, do you have anything to tell us?
Not all right, not exactly. So please, if you have any questions, just drop them on the group. We'll be there to answer all your queries and all your questions. And like she has said, we have different packages. So just pick the one that is very suitable for you. And we have the most advanced package that Timmy has highlighted. That is like a full package in that's a big one. That's a big one because it takes you from a point of A to Z. Even goes beyond the gut health. We analyze other health issues together. So thank you for joining our webinar tonight. Bye
All right,
bye.
thank you so much. Bye, everyone. Thank you.